Welcome to Virtual Physio. You're here because you are waiting for an appointment, an in-person appointment with your therapist. Could be 5 weeks, 6 weeks, and until then, what's going to happen? What's going to happen to that knee pain, to that shoulder pain? You're going further into questioning, what can I do that is not going to make it worse? What can I do that is going to make it better? Can I heal it? Can I improve it myself? Or do I really need fully only the expertise of a therapist? I'm here to open the doors for you, to open mindsets for you to understand and experiment how self-management strategies can be used safely at home to complement your healing before you step into a therapist door, especially if there is a waiting time that you have no control of. You're here and you're not broken, you're not forgotten, and we only need to start with gentle breathing, gentle movement, pain-free, soft, to start healing, okay? And while you're waiting, we're going to be healing together. So right now, I would like you to determine if your issue right now, your physical issue right now is presenting in swelling, heat, like feels really warm in the area, radiating heat. Is it radiating pain, which means is the pain traveling and being referred to another point, so you can tell where the pain starts and you can tell where the pain finishes? Are you in excruciating pain? And if you are scoring, you'll pay anything above 7 out of 10, 10 being the worst pain you can ever feel. And are you experiencing any type of weakness where it's making it really, really difficult for you to move a limb, to move a wrist, to move ankle up and down? And if you are experiencing any of these, I would like you to call your local healthcare system, guidance, telephone line, or your GP to discuss these symptoms, because that means you need of a more urgent appointment. If you're not experiencing any of these, maybe just a bit of swelling, maybe just a bit warm, the joint can still be mobile and moving. You're still functioning through the joint. However, you're experiencing pain, lots of pain, and it's on and off. It's with specific movements. We can help you. We can help you right now, right here. So if it's a bit of swelling, you can use cold compress or ice. If you're using ice, please make sure you cover the skin just with a cloth so you don't get ice burn on the skin. You can ice for 20 minutes, which is a set rule of time, or less. If you feel very uncomfortable with the ice, take the ice off and allow that joint or that muscle to rest. So you'll be resting for another 10 minutes or so until the temperature of the skin comes back to normal. This is then safe for you to mobilize, to walk, to get on and crack on with what you're doing. So if you're needing to ice because of swelling, just make sure that you allow yourself time for the icing time and also for the de-icing, so the temperature going back to normal, so that you can then use that joint in a safe way. If it is radiating a little bit of warmth when you touch it, touch the other joint to compare. Does it feel warmer than the other joint? Ice is also ideal. Same explanation as before, same concept, instructions. Just apply a cold compress or ice. If you're experiencing pain, the ice will soothe your pain for a good long period, maybe from a few minutes to a few hours. So perhaps you can use the ice if you are in pain, because then it allows you to just keep control of your pain. If you are, if you have a preference of not taking too much pain relief medication, perhaps it's a nice way of you alternating with your pain relief. Okay, because the ice, just time it, just time how long of a grace period you get from your pain from applying ice. You know your grace period from taking medication, but you can also bring that concept to understand what's your grace period from icing that pain. Also, pain can be minimized and diminished by touching it. And when I say touching, I'm talking about gentle touch. You can do just a pressure, okay? Gentle pressure. You can do gentle, light stroking. And if you are stroking, I would say always stroke upwards into the direction of the heart. So arm towards the heart, if it's leg, towards the pelvis and heart. And gentle stroking of the pain can help desensitize the pain. So that can help ease the pain. Most people will be doing that anyway. They'll be rubbing the pain. But this way, I want you to rub with more intention of soothing the pain. You are doing automatically, you are doing subconsciously because your body knows what to do. But let's invite the mind, let's invite the intention to allow the healing to be more of a complete cycle. So you are stroking, aware and knowing that this stroking can ease your pain. Yeah, so we're bringing a holistic approach to what we already know what to do. Your body already knows what to do. You've already been doing that. But it's about stroking the right direction. It's about intention with the stroke. You know it's happening. You know it's healing. Yeah. And this is how we flip from a prescription of an exercise to a holistic approach prescription for that exercise and becoming more whole for yourself, more specific, activating that healing ability. Yeah. And what else can you do? Resting. Allow yourself to rest that body part, that joint. So perhaps avoiding doing certain movements that is causing the pain, because every time you go and hit that painful point, we are then reactivating the inflammatory process. So for a few hours or even a few days, it's okay to avoid doing that movement that causes the pain. It doesn't mean that you're not going to use that body part at all. It means that you are still able to move that body part for all the functions, for all the movements, but not the ones that cause pain. And even other movements, you might find that you can slow down your movement because the speed brings cramp, brings sharpness. So slow down your movements, being mindful. Yeah, you're being mindful of your movement. And also move not as far as you would, or not carry as much weight or load as you would. So if you need to carry a basket of laundry, yeah, perhaps ask for help or carry half of the weight. I know you might need to go up and down the stairs more often. Ask for help. Pushing through is only triggering the inflammation to stay there, and it will stay there for the 5-6 weeks until you see the therapist. The therapist is going to detect that there is inflammation, and they're going to ask you to do exactly this then. But you can do it now. You can do it now and get there more pain-free. Okay. So I'm giving you only a few tips. These are safe to do if you're experiencing, of course, a little bit of swelling, a little bit of warmth and pain in the area of your body. And remember to protect yourself from icing, which of course you don't want to burn your skin. So a dry cloth ice on top or a cold compress should be enough. Thank you so much. We have so much more information in the website library, and I would love to see you maybe through a future Q&A session that we're going to be posting soon, and the dates will be coming up. Thank you.